Good evening, everybody. I'm Gayatri Suresh. I hold a degree in Master of Physiotherapy, and I have been associated with Prakara teaching biomechanics lectures. So today's session is going to be an exam preparation session specifically for the subject of biomechanics. Now, I have been told many times that biomechanics is somewhat a difficult subject, which I have attempted to simplify for you all with the lecture series that are with Prakara. And there are specific ways to write the answers to certain questions in biomechanics. So in today's lecture, in today's webinar rather, I'm going to go through all of those. And by the end of the session, you might find it easier to write and have a little more confidence in answering biomechanics-based questions. So I believe the question paper that you have within Andhra Telangana districts have essay questions, short notes, and very brief notes. Okay, so different universities have a different guideline, but it's more or less similar. You always have a long answer, medium answer, and a short answer. So there are some examples of essay questions. So as you can see here, this is a sample paper which I've taken to show you the examples. You usually have 4 questions in essay in which you have to attempt 2, which will be of 10 marks each. One good thing that is given in some papers is also the marks distribution. So even if it is a 10-mark question, but they're asking you multiple things within that, it is divided into, let's say, 5 plus 5 or 8 plus 2, depending on the importance of these different things. So first of all, in essay questions, you have to only attempt 2. So please read the options carefully so that you can figure out which one you know well and which one you'd like to attempt. Then you have short notes. You have 8 short notes, which are for 5 marks each. So these would be around medium-sized answers. You don't have any options here, so you have to attempt everything. And then lastly, you have 10 brief notes. These are very short answers, not more than 2-3 lines. And again, you don't have an option here. You have to attempt all of them. Okay, so that's the overall structure of a question paper which you'll be having. Essay questions 2, brief notes 10, and short notes 8. Okay, so this adds up to 20, 40, and 20. So around 80 marks of paper. So now we'll go through some general guidelines of answering biomechanics questions. Biomechanics is a subject where questions can be asked very differently. So for example, if you see, write an essay on arthrokinematics of knee joint, including locking and unlocking mechanism. This locking and unlocking mechanism is also called screw home mechanism. It's also called as a corkscrew mechanism of the knee joint. So the same question can be asked in different ways. So the first guideline would be to read the question carefully. Some questions may write explain, some may describe, illustrate means to draw. So if you're getting any such questions, definitely read it carefully so that you don't understand it as something else and all that. Because in biomechanics, you have a lot of synonyms. You have a lot of words that sound similar to each other but mean the same thing. Second is for biomechanics specifically, the paper is biomechanics and applied anatomy. Okay, so applied anatomy means you have to know anatomy before you can focus on excelling in your biomechanics paper. Because if you learn biomechanics as physiotherapist, you have to do it by knowing anatomy. If a mechanical engineer is learning biomechanics, they don't have to know anatomy much. They just have to know the levers, the torques, the velocity, all that. But they don't have to spend time knowing, okay, this is the bicep, it will cause elbow flexion, etc. But because you're a physiotherapist, your anatomy knowledge has to be strong before you can get into biomechanics. So that will be the first step before I tell you any tips or any answer. Do read your anatomy. There are many lectures in Prakara. There are many ways you can learn by demonstrating, by drawing on people and all that. So that's the very first step. Know your anatomy. Then after understanding the question, plan your answer. Usually for long answer questions, you have to have it like a essay format where you have to have an introduction, body, and conclusion. For short notes, you have to be very concise, but not as long an essay, but not as short as a very brief note either. So choose 3 to 4 or maximum 5 points based on the kind of question that's been asked and slightly elaborate on all of them. So the main concepts. So if I have to ask you about shoulder complex in detail, if you're writing it in a 10-mark answer, you'd have to define each joint within the shoulder complex. If you're writing it for a short note, you don't have to go into that, but you can directly go into the mechanics. And if you're asked in a very brief note, you can just list down the joints in the shoulder complex. So that's how you segregate the answer length based on how much marks the question will carry. Then lastly, for very short notes, mostly it is a definition example diagram. It is in general a hard and fast rule, draw diagrams wherever possible. It saves a lot of time. It also makes it easier for you to like show in a diagram rather than write sentences. It saves your time that way. And then the examiner knows. So no examiner has time to actually sit and read word by word. So if they have seen that you have an answer, if you have a diagram and you've labeled it fine, then they don't have to look for you labeling it plus writing descriptions down. They know that you know what you're talking about. Okay. So diagrams very important, neat diagrams very important, definitions definitely. I've had people who, let's say I've asked state Newton's second law. They'll just write law of acceleration. They'll not have defined it. They'll not have put a formula. So definitions wherever needed, diagrams wherever needed, bullet points wherever needed. Again, don't write very long paragraphs. People may or may not have time to read it. So as much as you can go into bullet points, that will be fine. Just excuse me for one moment. Then this is something that I've kept based on my experience of correcting answer papers. Even if I want to read a lot of things, I still want to know if the person has got the key points right. So if you have time while you're writing an answer, if you just underline certain keywords or certain highlighted points within the answer, it definitely helps the examiner a lot. So they know that you know what you're talking about, but just by looking at those points. It's very useful to incorporate examples where you can, because the whole point of learning biomechanics is to apply it in your real life. So an example that I've given here, if you're having an answer on lever systems or mechanical advantage, show an example of lifting objects or show a human body example of class 1, class 2, class 3 lever to show that you know what you're talking about. Okay, same can be with force vectors, same can be with other Newton's laws. So with Newton's laws of inertia, you can say that a lighter person will be able to propel a wheelchair faster than a heavier person because a heavier person has more inertia. Therefore, they have to put more effort into moving an object. Okay. Then write according to marks is something I just spoke about. The same answer can be written for 10, 5, and 2 marks, but you have to decide how much to write based on the amount of marks. Like in 2 marks, you'll not sit writing entire shoulder complex just because it asked. You'll just enlist the different joints within the shoulder complex. Then definitely one thing is you have to manage time. Biomechanics is mostly a conceptual subject. It's not a very theory-based subject, which I'll get into it later. What concepts you need to understand before you actually can attempt any question within biomechanics. What I used to do is obviously the 10 mark or the essay questions, they take the maximum marks. So in your case, I think essay questions are 20 and okay, short answers are 40. But what I used to do in my papers when I was a student was attempt the essay so that one big thing is done. Essay needs a lot of time. It needs a lot of handwriting skills. It's like if you write it in the end, your hands might get fatigued. So when you're fresh in the paper, you can attempt the essay questions. Then to take a short break, because even the short answer requires you to write a little bit more. So after completing essay, to take a break from writing, you can attempt the very short answer or the brief answer question so that you can write just a line or two without having to think too much or without having to put a lot of effort. And then lastly, you can come to the short answers. But then definitely make sure that you're answering all questions within that section. So it's not like you answer one essay, then one short answer, then one brief answer. Then it becomes very confusing. Choose sections and order them accordingly. Some people may feel that if they're done with brief answers, at least small work is done. That is completely okay. But this you will understand when you have attempted some practice exams to see what is suitable for you or what you feel easy when it comes to finishing the paper on time. So here are the general guidelines: understanding the question, planning the answer, planning how much to write in each kind of question, including definition, examples, diagrams wherever needed, whether it's asked or not. It definitely helps you in the long term. Then highlighting some key points. This is something from my personal experience of correcting answer papers. It really helps. So some people may have the time to read word by word. Some examiners may not. So for the ones who don't have that much time or to do all this, then highlighting really helps. Then incorporating examples, writing according to the marks, and managing your time, general guidelines. Now, like I told you, biomechanics and anatomy go together, especially for physiotherapy subjects. Even if you see the paper names, it is biomechanics and applied anatomy. Now, in UG level, you don't have applied biomechanics, so that is not something you'll have to worry about very much. Applied biomechanics goes into how do you assess the things that biomechanics says. So let's say you're talking about the arthrokinematic motions of the shoulder, like convex concave rule, or you're talking about the fact that shoulder is a triplanar joint. There are assessment methods for these. How do you assess the triplanar movement in the shoulder? How do you assess the convex surface moving on the concave surface? These come in applied biomechanics, which you usually don't have in UG. So you don't have to worry about that, but definitely biomechanics needs a lot of applied anatomy. So here is a structure for long answer. Okay. Usually in long answers, I'll just go back to this slide. So the first question, explain the shoulder joint in detail. It can be replaced with explain knee joint, wrist, elbow, ankle, hip, anything. Any major joint in the body can be asked in this question format. Okay. Usually they ask synovial joints, so joints which have articular surfaces, synovial fluid, capsule, etc. So that becomes easy. You don't get much into fibrous joints or cartilaginous joints. So for a 10-mark answer, usually synovial joints are asked. Shoulder joint can be replaced with anything. Now, when you get such joint-based answers, this is the format you have to follow. This is more than enough to talk about biomechanics of almost any joint. Like I said, you need to know anatomy. So the first thing, you name the joint. If you see, most of the joints within the body, they're not one joint. They're joint complexes. So shoulder is made up of 4 joints, right? It is the sternoclavicular, the acromioclavicular, the glenohumeral, and the scapulothoracic. So if you're told about the shoulder complex, you have to write these 4 ones. If it is the knee complex, it is the tibiofemoral and the patellofemoral. It is not just the knee. It's made up of 2-3 joints, right? So like this, when you name the joint, also name the joints within the complex. That's why when you go more into advanced biomechanics or anatomy, you stop calling it the shoulder joint or the knee joint. You start calling it as a shoulder complex, knee complex, etc. Then is a type of joint. Now, like I said, you mostly get synovial joints, which is good for you because there is a lot to write in synovial joints. Like you can't write much in sutures. Like if someone asks you write about sutures, then how much can you write for 10 marks? Okay. So in type of joint, synovial has 8 or 9 types. The knee is a modified hinge or a double condyloid. The hip is a ball and socket. Shoulder is a ball and socket. Wrist might be slightly ellipsoidal. Then ankle might be a hinge type of joint. Okay, so here you have to write the type. Why? Because the type of joint determines how much motion that will have. If you see the ankle, you know for a fact that it will not be able to move sideways much or in a rotatory motion. The shape itself shows that it's going to move in a uniplanar motion. It's going to mainly move in sagittal plane. That's why you have to write the type of joint. Now, to simplify synovial joints. Synovial joints will definitely have articulating surfaces, joint capsule, and hyaline cartilage. Excuse me. Whether or not you know the other structures, definitely write these 3 things. These will definitely make up a synovial joint. If you take shoulder, for example, if you take glenohumeral within the shoulder, articulating surfaces would be the head of humerus and the glenoid fossa of the scapula. Then it has a shoulder joint capsule, which covers the entire shoulder, and it has hyaline cartilage. So, the capsule here is mainly weak in some parts and strong in some parts. So the capsule in each synovial joint will have its own features. So the knee joint capsule is quite strong. The ankle joint, not so much. The shoulder, in some parts it's strong, in some parts it's not. So articular surfaces, capsule, and hyaline cartilage, definitely something you'll find across all synovial joints. Over and above this, if you have to get little more into anatomy, some joints have some specific or special features. For example, IV joints have a disc. A glenohumeral complex has a labrum. Then something else will have another small disc also. The sternoclavicular has a very small disc, a disc which is very different from an IV joint disc. Okay, so the main parts in a joint versus some special features specific to that joint. Not all joints will have discs, not all joints will have labrum, etc. After you're done with this part finishes your joint structure. So the first part of your 10-mark answer is done. You have explained the anatomy of the joint. Then you come to joint kinematics. Kinematics is movement. So if you study the fundamental concepts of biomechanics, kinematics is a study of movement without studying forces that cause or affect the movement. So in this, to understand kinematics, you first have to know the convex surface and concave surface. So when you start writing joint kinematics, say that, again, I'm taking glenohumeral as an example. The humeral head is the convex surface. The glenoid fossa is the concave surface. Then you write the osteokinematic motions of the joint. By osteokinematic motions, I mean the physiological movements available at the joint. Here you can write shoulder joint has flexion extension, abduction adduction, medial and lateral rotation. I may have changed the order a bit. You can also write which movement in which axis and plane. Again, the axis and plane comes in the fundamentals of biomechanics. So flexion extension happens in sagittal plane around frontal axis. When you're talking about plane, you have to say in the plane. When you're talking about axis, you have to write around the axis. Okay, so flexion extension happens in sagittal plane around frontal axis. Then abduction adduction happens in the frontal plane around the sagittal axis. Medial lateral rotation happen in the transverse plane around the vertical axis. This tells you a lot about the movement happening at that particular joint. After you're done this, you can talk about degrees of freedom and what kind of planar joint that is. So because the joint can move in all the three planes, you can call it having 3 degrees of freedom. If you take elbow, for example, it mainly can move in flexion extension. It does not have a lot of rotation around it. It does not have a lot of abduction adduction. That makes it a 1 degree of freedom. Some joints like the wrist, they can move in flexion extension and deviations, but they cannot move in rotations. They have 2 degrees of freedom. Okay. Joints having 3 degrees of freedom are called triplanar joints. Makes sense because they move in 3 planes. Joints which can move in 2 planes are called biplanar joints and 2 degrees of freedom. Joints which move in 1 plane are uniplanar, which have 1 degree of freedom. Then you move on to range of motion, another descriptor of movement within kinematics. Each joint has a specific range of motion, both starting and ending. You have to ensure that you're mentioning both start and end. So shoulder flexion starts from 0, goes up to 180. Similarly, shoulder abduction also starts from 0 and goes up to 180. The way you write this is flexion 0 to 180, extension 0 to 45. So don't just assume that if you write extension 45, people will assume it. No, you have to write starting and ending. Some joints like the knee joint, they don't have further extension. So you have to write flexion 0 to 140, extension 140 to 0. There is no extension beyond 0, like the shoulder has. Shoulder from 0, it can go back 45 degrees. So you have to write available range of motion for each joint. Then when you start talking about kinetics, so first 3 points or first 5 points are anatomy. Next 4 or 5 points are kinematics. Next few points will be kinetics. Kinetics will be study of movement with regards to forces. So here you're not seeing quality of movement. Here you're seeing forces. So first concept is end feel. By typical definition, end feel is what a therapist feels when they passively do a movement. But that can be a little complicated definition. How I would define end feel is what stops a movement in a joint. If I'm doing elbow flexion, why is my elbow flexion stopping here? Right? It's because of the approximation between the forearm muscle and the biceps muscle. 2 structures are coming in contact. That's why the movement is stopping. When this happens, it's called as a soft end feel, when there are 2 structures which are coming in contact. Another example of a soft end feel would be knee flexion, where the calf comes into contact with the hamstrings. Second, you have, if I do a wrist extension, this surface of the wrist is not coming in contact with my forearm. So then why am I not able to take it more than 90? It's because I'm feeling a stretch over here. This is called as a firm end feel, a stretch-based thing that stops the movement. Okay. Then third is elbow extension. My biceps is not getting stretched. The forearm is not coming in contact with the tricep. So what is stopping the movement? It's because of bone-to-bone contact. This is called as a bony end feel. If you write this, it will definitely give a lot of value to your 10-mark answer. So as homework after you're done with this webinar would be to document end feels of different joints. Okay, so what stops hip flexion, hip extension, knee extension, ankle dorsiflexion, etc. Classify it into soft end feel where two structures approximate, firm end feel when a stretch at some structure is stopping the movement, and bony end feel when the movement is being stopped because of bone-to-bone contact. Then each joint, whether upper limb or lower limb, has open chain and closed chain movements. Open chain is, let's say I have my hand here and I move my wrist. My wrist will move irrespective of position of my shoulder. If I want to make a fist, I can do it with my hand by my side or my hand above. But whether my hand is by my side or above, it will not affect my ability to do a gripping action. But if I'm doing a push-up, the wrist will move exactly how the shoulder will move. It cannot move independently. So this is a closed chain movement. Per shoulder, an overhead reach is an open chain movement. A push-up or a pull-up is a closed chain movement. The movement in closed chain will depend on the other joints. In open chain, it will not depend on the other joints. Then you have muscles and what movement they produce. Now, earlier in kinematics, you wrote that flexion happens in shoulder, extension happens. But how does it happen? What is making that happen? That is kinetics. So you say that flexion is caused by anterior fibers of deltoid and some amount of pectorals, abduction caused by supraspinatus and middle fibers of deltoid, and to some extent trapezius, etc. This is again where your anatomy comes into play. Use this format and you'll be able to write about any joint. If you know anatomy and if you know the very fundamental concepts of biomechanics, you don't actually have to sit and read every joint side by side. Some joints have some special features which you will have to read. So for example, knee has the screw home mechanism or the locking and unlocking mechanism. Shoulder has the scapulohumeral rhythm. Lumbar and hip have the lumbopelvic rhythm. These are some special features specific to some joints. So if they're there, you'll have to learn that separately. But this format is okay to answer any joint. You write all of this more than necessary for a 10-mark answer. Then the next kind of question. This is a very commonly asked question, stability and mobility in the vertebral column. You can also be asked stability and mobility in the wrist, stability and mobility in the ankle. All of this you have to answer with what you know in anatomy and this structure that I just told you. Stability is mainly given by joint structure. For example, the shoulder. It has a very large humeral head and a very small glenoid fossa. That itself tells you that the bony structure is not going to make that joint stable. But if we take the elbow, the olecranon and the olecranon fossa, they are like a hook and key. That itself tells you that stability to the joint is given by the shape of the bones. So the first factor that affects stability is the shape of the bones. Second, by the ligaments around it. Ligaments are always there to protect the joint from excessive movement. So if I'm having shoulder 180 degree, why am I not able to go back? One thing is definitely the end feel. Second is you also have ligaments holding the movement. For example, if I have an unstable shoulder, if I do this movement, it may not go smoothly into flexion. It might, go a little with excessive movements. So apart from joint structure, the ligaments around that joint provide stability. Now muscles, while they definitely have mobility action, the way they are placed gives them stability function as well. In the shoulder, bicep definitely does elbow flexion, but the long head of bicep goes and attaches over here in the shoulder. So the long head of bicep is, the tendon is placed to give stability. So whenever you get a question about stability and mobility, write about the structure, whether the structure will give it stability. If it does, then write about the additional ligaments that give it, and then about the muscles around it. In some special cases, discs can also give stability. So the sternoclavicular joint has a disc. The intervertebral joints have discs. So you write about them and you write why they give stability. So don't just write the shape of the elbow. Say how is the elbow shaped to give it stability, and why is glenohumeral not stable? The bones itself are not there. Apart from this, because there's synovial joints, you'll also have a capsule. The capsule will hold a vacuum. So now, for example, you keep your arm down the entire day. Why is your arm not dislocating? Because of the force of gravity. It's because you have a strong capsule with a vacuum effect that has a suction pressure, obviously with help with ligaments. So any factors in that joint which you think will give stability, write all of them. When you come to the mobility, again, mobility is also dependent on shape of the joints. Shoulder, the biggest example. It's because that the humeral head is larger than the glenoid fossa, you can have movement even in circumduction because the socket is not holding the head in, unlike the hip. So mobility is also determined by bone structure. Then you have to write about what all movements are available at the joint, which is again determined by the bone structure. Ankle allows hinge-like movement. If you see the ankle, like do see the image of ankle after you're done with this webinar, the tibia and fibula have a square box kind of shape in which the ankle is fixed. It cannot move sideways even if it wants to. It has to move in the upward and downward direction. So here you have to write about, because of shape of the joint, what movements are available. And then you write about what muscles help with mobility. Okay. Now, in specific to vertebral column, there are regional differences. Now, they haven't asked stability, mobility in thoracic spine. They have asked in the entire vertebral column. So here you have to shed a little light on how they compare with each other. So you have cervical, which has the largest range of motion because of the shape of the bones and because of the fact that it does not have a lot of loads on it as compared to lumbar spine. Followed by lumbar spine, which has more range of motion than thoracic. Least range of motion is in thoracic. Why? Because thoracic, the spines of the vertebra, they're pointed downwards. So if this is one spine, this is another spine. Even if you want to move, it will not allow. Whereas when you have horizontally placed spines, you have this much movement available, which is the case with lumbar spine. Plus, thoracic has the protective function of protecting the lungs and the heart, etc. So it does not allow a lot of mobility. It's very easy to draw diagrams here. Prakara, their social media has a very beautiful videos on how to draw. So it's very easy to say draw it. But Prakara on their Instagram, they actually have tutorial videos on how to draw different joints. So you can definitely check them out. So to summarize, if you are asked stability, mobility of any joint, think of all the anatomical factors, including the ligaments, the shape of the bones, the capsules, the muscles, and discs, any additional structures. Labrum, for example. So shoulder has the glenoid labrum. Because the glenoid fossa is so small, it cannot give enough concavity for the humeral head. It has a labrum surrounding it, which deepens the concavity. So that is also a stability feature. Obviously, to know this, you'll have to know anatomy. Okay. Yeah. Then coming to the next question. Arthrokinematics of knee joint. Here, because it's a 10-mark question, you can go into definition of arthrokinematics, whether it's what is a roll, what is a glide, what is a spin. So you have to define arthrokinematics, which are small movements that help completing the osteokinematic movements. So flexion extension happens. But then to do the flexion extension, you need some amount of twisting, some amount of rotation, some amount of gliding so that things can move. Imagine the humeral head was fixed here and you had to do abduction. You would not be able to do it. You're able to do abduction because the lower end of the humerus is coming up and the humeral head is sinking down. So as you go up, you can see that the humeral head sinks down. It doesn't go up. So these are small adjustments rather to help with osteokinematic movements, right? So here you define arthrokinematics. You define there are three arthrokinematic movements, that is roll, glide, and spin. Then you have to tell which are the concave and convex surfaces because arthrokinematics largely depend on that. In case of tibia and femur, the femoral condyles are the convex surfaces and tibial condyles are the concave surfaces. If you read the convex concave rule, if it is a convex surface moving on concave, the roll and glide will happen in opposite direction. Shoulder abduction, for example, it's an upward roll a downward glide. This happens when convex is moving on concave. In concave moving on convex, roll and glide happen in the same direction. Okay, so if I take these two as the knee joint, if you have the femur moving down in a squat position, it's a posterior roll and anterior glide. But if you have the tibia moving up, it's anterior roll, anterior glide. Okay, so here when you define the convex concave surfaces, you can talk about how the roll and glide happens. You usually don't talk about spin much, but knee is one place where you talk about spin. That's where the screw home mechanism happens. But otherwise, you're not able to explain spin much because it's very complex to explain that. It's a very minute movement as compared to roll and glide. So in tibiofemoral, you talk about flexion extension movements happening. Then you talk about example of convex moving on concave, that is tibia moving on, femur moving on tibia. And then you give an example of concave moving on convex, that is tibia moving on femur. In patellofemoral, you have the concavity on the femoral sulcus, and you have the convexity in the back portion, the posterior surface of the patella. So with flexion, the patella is pulled down. With extension, the patella is pulled up. So mostly it's the convex moving on the concave. Once you've mentioned these movements, then talk about how the roll and glide happens. Then unlocking, which is also called as screw home mechanism or the corkscrew mechanism, it's a very commonly asked question. The basic concept here is using the spin arthrokinematics. So it's not something very different. It basically states that when going into terminal extension, there is a spin that locks the knee joint. Locking of the knee joint happens automatically because of the velocity of the movement and the shape of the condyles. You have the medial condyle, which is large, medial femoral condyle, which is larger than the lateral femoral condyle. So when someone is going into terminal extension, lateral femoral condyle has completed its movement, but the medial femoral has not. So then there has to be a slight twist so that the medial femoral can go slightly forward and lock itself in place. This is the locking mechanism of the knee joint. This happens automatically. It does not need a muscle activity. But to unlock, you need a pull from a muscle to rotate to unlock. That pull comes from the popliteus muscle. Here you have to mention the position of the popliteus muscle and the origin insertion to show that how it is placed well to make a pull on the femoral condyle to unlock. Okay, that's the screw home mechanism. Here, as I can see in the question, the screw home is asked for 2 marks, but arthrokinematics takes major of the chunk of the answer. So you have to answer according to the marks. Sometimes you may get the screw home mechanism only as a separate question. That time you have to expand on it. And then this is a good place to use diagrams to depict movements. You can actually show that the medial femoral condyle is larger than the lateral femoral condyle. Then you have mechanics of respiration. This is usually not a very commonly asked question. But if it is, then it is asked for either 10 marks or a short answer format. So in mechanics of respiration, you describe the shortly, briefly, this is not a cardio paper. Okay, so you don't have to go into extreme structural anatomy. You have to briefly describe the respiratory system and how inspiration happens and how expiration happens. So you mentioned that inspiration is an active process and expiration is a passive process. Like you need effort to breathe in, but you don't need effort to breathe out. Here, you also mentioned that the effort to breathe in is caused by diaphragm and internal intercostal muscles. But if you need over and above tidal volume, like now I'm breathing, you're not seeing the movement at my shoulders. But if I breathe, you saw that my shoulders had to rise up. So then you have help from scalenus, you have help from trapezius. So you mentioned these muscles that help with breathing that requires more than quiet breathing. Then if you breathe out naturally, there's no effort. But if you'll feel a contraction of your abdominals. You'll feel some contraction in your chest. So that's the external intercostal muscles and the abdominals. So talk about muscle work in quiet breathing, that is diaphragm only, and internal intercostals. And for exhalation, nothing. But for forced breathing or exhalation, or if someone has just run a marathon and they're trying to catch their breath, you need more muscles. Okay. Then you talk about Boyle's law. So you can refer your cardio syllabus, but you may or may not mention this. So again, this is not a cardio paper. You maybe have to talk about the mechanics of it. So the muscle work, the kind of movements that happen, etc. And pressure volume. So usually there's a drop in pressure with inhalation, and then vice versa. And then the last major thing here is you have to mention the pump handle, bucket handle, and the piston movements. Pump handle happens in the upper respiratory bones, where you see the sternum moving forward and back, which is like a pump. And then bucket handle is in the lower ribs, where it moves outwards and inwards. So in the upper ribs and the sternum, you have a forward-backward movement, which acts like a pump. In the lower ribs, you have a bucket handle, which moves outwards and inwards like a bucket handle. Piston is the diaphragm moving up and down. So here you've explained kinematics by explaining these three movements, and you've explained kinetics by explaining how the muscles work. Very good answer to draw diagrams. It's very easy to draw the sternum sideways and the curved lower ribs from a front view. Definitely draw diagrams for this, because then only people would have actually understood that you know. If they don't have time to read your answer, they'll look at your drawing and they'll know that you've got the answer right. So that was about the essay questions. You can get mainly any joint in detail, mostly synovial joints. You'll not get like sutures or tibiofibular joint much, because they're cartilaginous. You don't have much to write in them. They don't even have a capsule. Okay, so you'll mainly get synovial joints. Stability, mobility can be asked for any particular joint. Arthrokinematics can also be asked, but then this is a very favorite question to ask, because screw home mechanism is a very popular question. Mechanics of respiration, not that popular of a question, but once in a while it is asked. Now we'll go to the short notes. Okay, so short notes mainly has three steps. First is you define or explain the concept or principle. Then you show an example to describe the principle that you just defined or stated, and then draw a diagram. This is true for pure biomechanical concepts, not for anatomical answers. So there are a combination of both, which I'll just go through right now. So these 4 questions, which I got from the sample paper, let me show you here. Yeah, so here you have 8 questions. 4 of them are biomechanical questions, 4 of them are anatomical questions. So I'll show you how to go through each of them. Biomechanical examples. Anatomical pulley, you have to describe what a pulley is. Okay, it's a structure that alters the direction, just like how you use a pulley for the rope on a well. If there was no pulley, the rope would go straight up. But because there's a pulley, the rope is curving over something and coming down. So similarly, in the human body, an anatomical pulley alters the direction of a structure. Then you have to give examples. There are multiple examples. Patella for quadricep is the major example. If patella wasn't there, the quadricep would pull the tibia up directly. But because the patella is there, the force goes little horizontal. Okay. Imagine the tibia as a bucket of water and the quadricep muscle as the rope, and the pulley as the patella as the pulley. So you can imagine that. Another one is the flexor digitorum, the flexor digiti minima with the pisiform bone. That's another pulley. Then you have sesamoid bones in the beneath the great toe, which acts as a pulley for flexor hallucis longus. So these are some examples of pulleys. And then you have to draw the diagram. Show without the patella where the direction would be, and with the patella how it would be. That's enough to answer a 5-mark question over here. Then concurrent force systems. This is from your fundamentals of biomechanics in force systems. So you talk about linear, concurrent, parallel force systems, rotatory force systems, etc. Concurrent is 2 forces are acting but not on the same line. They're acting in 2 opposite directions. So they are coplanar but not collinear. They're not acting in the same line, but they're acting in the same plane. Okay. So this is, you define it. Then you have to give an example. So the most famous example is the deltoid. Deltoid has middle fibers which act by pulling straight up. Anterior fibers act in this direction because they're oriented little slanted. Posterior fibers pull in this direction because they're oriented backward slanted. So the anterior and posterior fibers have concurrent forces. But then, as with the law of parallelogram, they converge at some point. So even though you have 2 forces pulling in opposite direction, the net result is an upward pull. You don't see the shoulder pulling you forward, backward at the same time, even though they are in different directions. So that's the rule of a concurrent force system. Somewhere they converge, and then they have a net result of an upward pull, a resultant force. So here with a diagram, you have to draw the delta and show the direction of arrows, and show one bold arrow showing a straight upward pull, which is the result of two forces acting on that particular muscle. Then active insufficiency comes in muscle mechanics concepts. Active insufficiency means that a muscle cannot be efficient when it shortens at more than one joint. Specify that this is true for two joint muscles and not single joint muscles. If I have my wrist flexors, wrist and finger flexors, you can see that if I bend my wrist, my fingers tend to go into extension. If I extend my wrist, my fingers go into flexion. I am not taking them into extension and flexion. It's happening on its own. But if I have my wrist in flexion and try to make a grip, I'm not able to make a fist completely. There's like a hole over here, there's space. That itself means my grip is not optimal because it's shortening here, it's shortening here. It's like pinching. Similarly, if I extend my wrist and I extend my fingers, I'm not able to keep it as well in extension as I would if I flex my wrist. You can see that here you can see a hyper extension of some sort, but here not so much. Because extension and extension means it's lengthening. This is passive insufficiency. So when there is shortening at two joints, it is active insufficiency, that the muscle cannot be optimal if it is shortened at more than one joint. If it is lengthening, if it is stretching from joint 1 and joint 2, it is passive insufficiency. That means it cannot lengthen efficiently when it crosses more than one joint. Okay, so you define it that way. I just gave you an example of finger flexors and wrist flexion. You have a similar example in rectus femoris. So rectus femoris causes hip flexion, knee extension. Usually knee extension is better. No, sorry. Yeah, usually knee extension is better with a hip extension because it's not getting insufficient, right? Then you have the next question, mechanical advantage. So here again, you define it. It's a ratio of effort to load arm. Then you can give an example of biceps. How would the mechanical advantage of biceps be? How much is the load? So from the point of insertion, the load is near the hand. Okay, and from the point of insertion, effort is very small, right here. So the ratio between this distance and this distance technically makes it mechanically disadvantageous. Then you talk about gradings. Mechanical advantage is if it's equal to 1. It's very much advantage if it's more than 1. Less than 1 is mechanically disadvantageous. So this is something you can draw in a lever system and draw an example from the human body. So this is a framework you can follow for biomechanics based concepts, not so much for anatomy based concepts. Like how will you define like TMJ motion, right? Here you have to change your strategy slightly depending. There's no fixed strategy here. Anything can be asked, so you have to write accordingly. But I'll still explain the answers that have been questions that have been asked to you. So first is TMJ motion, temporomandibular joint motion. So they have been the question I believe was asked as describe the 1 minute. Muscle control of temporomandibular joint motion. Basically kinetics of the joint. Okay. So you have to talk about osteo and arthrokinematics, talk that there is depression, elevation, side-by-side movement, protrusion, retrusion, all of that. If you have some time, write about how the discs help with the movement of forward glide plus depression when you open your mouth. Okay. Then you have to just write about the muscles causing the movement. What muscle cause lateral movements, the pterygoids. Then what muscles cause depression, what cause clenching of the teeth, etc. And with that, you basically can answer the question. It's a very nice idea to draw the diagram of the TMJ. It's not that hard. You can again refer to Prakara videos. Then next is a power grip. It's something to do with hand mechanics. There are different types of grip in the hand. So you have a fist, you have a cylindrical grip, a spherical grip. Then you have a pad to pad grip. You can grip something like this. You can grip a key with this kind of movement. So there are different kinds of grips in the hand, gross motor skills and finer grips. So power grip, you have to talk about what kind of grip it is. You have power and you have precision. So then in power, it involves the entire palm and the fingers. Precision requires fingers. You don't use the palm. So you introduce it that way. Then power grip has many. So cylindrical is a power, spherical is a power, then hammer is sort of a power grip and all that. So this you give examples. Then another reason why you need to study grips is the muscular activity. You need both the FTP and the FDS to do the power grip, but not so much when you're doing a small precision grip. Okay. Then you can draw a diagram. You can draw a hand holding a bottle, etc. Then next is plantar arches. These are special features in foot biomechanics. Okay. So foot biomechanics you study according to that framework that I gave you. In that, plantar arches are a big thing. You don't have arches as such in other joints other than the hand and the foot. So you describe them. There are three kinds of plantar arches: medial, lateral, and transverse. You have to explain the structures making these arches. They're not caused by any one thing. They're caused by the structure of the bones, the muscles surrounding them, the tension in the ligaments, and the kind of movements that are done. So you have bony contributors to the arches, muscular contributors, ligamentous contributors, and mechanical contributors. So you explain all of these things to explain how the arch is held. Then the function of the arches is to conform to different shapes as compared to a very flat kind of foot. So shock absorption, weight distribution, and changing shape to accommodate different terrains that are being walked on. And it's a very good idea to draw these arches. So you can draw, you don't have to draw all the three views, but just show that you can draw the medial arch, which is the most prominent one. Then you have elbow joint collaterals. Anatomical question: any hinge joint will have collateral ligaments. You will see it in the ankle, knee, and elbow, and even the interphalangeal joints of fingers. Any hinge joint will have medial and lateral collateral ligaments to prevent side-by-side movement. Okay, so then you have to show the structure. In elbow joint, you have to show the attachments. Where does it start from? Where does it end? What are their function? They resist varus valgus forces and to some extent some rotations. And then you have to draw a labeled diagram, which shows the position of the ligaments. This is a very small answer. You don't have, there's not much to actually say, like describe about it. Some ligaments, let's say knee, are within the capsule, outside the capsule. So if this question is asked for knee, you have to mention which ligaments are present within the capsule, which ligaments are present outside the capsule. Okay. Apart from this, some very favorite questions for short notes are the scapulohumeral rhythm, which is a coordinated movement between scapula and humerus to cause the overall 180-degree movement. Lumbopelvic rhythm is another very favorite question, which is again a coordinated movement between the lumbar region and the pelvic region. Both of them working together ensures that you have enough flexion to touch your toes and that you're not having too much effort to come back up. These are not given in this sample paper, but they're very common movements. So instead of active insufficiency, they can ask you passive insufficiency. Then they can ask you linear force systems instead of concurrent. They can ask you precision grips instead of power grips. They can ask you about spinal ligaments. So the 6 ligaments in the vertebral column. Very famous question, very favorite question. They can ask you about that and things like that. But again, these are not outside what you learn in joint biomechanics. They're just small bits and pieces of what you learn in joint biomechanics. Then lastly, we come to a brief note. This does not need more than 3 to 4 lines or 2-3 lines. Okay. So it is a definition, short description. Like I said, this can also be biomechanical concepts versus anatomical concepts. If it's a biomechanical concept, then you need to write a definition. If it's an anatomical concept, write a short introduction or description. Then you have an example to it. You can correlate it with human life. If you feel you can draw a diagram, definitely draw a diagram. Okay, so I'll go back here. Yeah, law of acceleration. You have to write that it's Newton's second law. Define the law that force is directly proportional to, acceleration is directly proportional to the force and inversely proportional to the mass. Write the formula. So here you don't have diagram, but you have the formula. Functions of menisci, just list the functions. If it was a 10-mark answer, you would have to draw the structure of the menisci, attachments, how description of medial lateral meniscus, how it is placed in the knee, etc. And then its functions. But because this is a brief note, it's just a 2-mark answer. You can write 4 to 5 functions of the menisci, half mark for each function. And then center of gravity in human standing. Define what the center of gravity is. the point where the entire gravitational force or the mass of the object is concentrated. And in human body, in standing, it is anterior to S2. Great idea to draw a diagram here. Articular surfaces of the wrist, you have, for any joint, you have a proximal articular surface and distal. So proximal would be the radius. Ulna does not participate in wrist articulation. And the distal surface would be the proximal carpal bones. So the scaphoid, lunate, triquetrum. Okay. Hyaline cartilage, it is an articular cartilage that covers the surface of bones. Okay, you have three types of cartilage: elastic, fibro, and hyaline. Hyaline is found in all synovial joints. It may not be found in almost the suture kind of joints, but definitely you'll find hyaline in synovial joint. So define it as a cartilage which is found on articular surfaces of synovial joints and draw a diagram. You need not draw a specific bone, just draw two bones with a different color, draw the cartilage to show. Prehension is grips of the hand. You can list down the different types of grips, so power grip and precision grips. But prehension means hand function. In the same question they've asked for Newton's laws. So law of reaction is Newton's third law. So you define it. For every action, there's an equal and opposite reaction. A very good example of this is ground reaction forces. So if you've studied gate or if you have reached gate till you have answered your question, you can show the initial contact. So you can draw one arrow saying that this much force is going from the body to the ground. And then you draw an arrow back up saying from ground, this much force is coming back on the person. Naming types of muscle contraction, just name. You can give a one-line definition because naming anybody can do, but you need to understand what this is. So in types of muscle contraction, you have isotonic, isometric, isokinetic. Isotonic, constant tension. In that, you have concentric and eccentric. You have to define concentric as against gravity movement, which shortens the muscle fibers. Eccentric is towards gravity movement that lengthens muscle fibers. Okay. Then isometric is constant length. Muscle tension is there, but the length does not change. Isokinetic is constant velocity. And so you list these down and you can give a short definition of it. This is a question which is again commonly asked in either 5 or 10 marks. If it is asked there, then you have to in detail give definition, draw diagrams, give examples of what is concentric, eccentric, isometric, etc. Supination and pronation twist usually is again asked as 5 or 10 marks, not as 2 marks, but you can call it, this is a function of the transverse tarsal joints, tarsometatarsal and the transverse tarsal joints. So there's a twisting motion in the foot that ensures that the entire foot is on the ground. So hind foot is going into supination, forefoot will go into pronation to ensure that the foot is on the ground. If the hind foot is going to pronation, forefoot will go into supination. This is the twist that ensure that the foot function is adequate when someone is walking and they don't lose balance. Okay. Q angle from knee biomechanics. Define the angle that it is made by a line formed by ASIS to the midpoint of patella and another line from midpoint of patella to the tibial tuberosity. Definitely draw diagrams for this. Even if you write Q angle to the best knowledge that you can and you don't draw a diagram, people will not consider your answer. Draw the pelvis, draw the femur, draw the tibia, and mark these 3 points and make lines and make the angle. Then, as an additional part, you can also mention normal values. How much is the normal in women? How much is normal in men? Okay. So this sums up the entire question paper. You may ask any questions if needed on to the Prakara faculty or the Prakara groups. I'll be happy to answer. But you have to know anatomy. You have to learn the fundamentals. So in the Norkin first 3 chapters, every basics has been covered. You know that well, you don't even have to read much forward. Okay. Otherwise, you can refer the answer notes which Prakara has prepared for you, the exam questions, the notes, etc. And I'm always available for any questions. So thank you for having me, and I hope that helps, and all the best for your exams.